I know.
Oh, no. Not too bad. They actually...
Folks here represent various disability groups, the aging community, families who have children with disabilities, and even though the Senator has expressed over and over that we need long-term service, I think the prime opportunity to do what we've promised over the last 5 years. We're fed up. We can't stand seeing our brothers and sisters locked away in nursing homes and institutions getting older.
The Senator's schedule, during the last number of months, I know just how stressful and full it's been. But, the thing that's hard for us is that we've tried for literally 5 years coming to D.C. as well as here in Montana to get a face-to-face with the Senator and have him meet with the disability community, and we've been turned down every single time. It's only been staff we've been able to meet with. We've been to the office many times and have met with staff, and every time we're there, the Senator comes out and is greeting other people and taking them back and talking to them, and this has literally been for the last 5 years. So it's more than just the schedule right now. It just doesn't feel really good about how the Senator looks at the disability and the
I want to let people know that we talked with David Schwartz for quite some time. And then he had to leave. They ended up, again, scanning and emailing the demand statement and the press release again. We're waiting to hear back from Holly. Still trying. And actually, now they are talking about trying to schedule a meeting with Max in person at home during the August recess. Which, if they did that in Helena, then people from all of the CILs could potentially be there, which I think would be and as well as the CILs, as well as the aging organizations and AARP, and right. So that was, in terms of where they're coming from with that, I will tell you that. First of all, I'm not sure that the markup will happen before recess. I don't know that. If it does, we told them that we're not giving up on this, and at this point we're not going anywhere. The folks in D.C. are not getting anywhere in D.C., so they may be at the Democratic National Committee all night. I don't know. Or for 2 days or 3 days, whatever they need to do. The other thing that David said was that even once there is a markup, there's still things go to the Senate floor, and there's still time there. We were very clear that that's, we recognize that that's part of the process, but it makes we're positioned much better if we have something in terms of long-term services supports and healthcare reform before it goes to the Senate floor. The other thing is that he talked about all of the tough choices that people have right now in terms of trying to figure out what's going to go into healthcare and what's not going to go into healthcare. We were very clear there about, we recognize that there are a lot of tough choices, but given that this one involves one of the very basic tenets that this country is built on, which is freedom. Like, how can you compromise individual freedom? How can you compromise somebody's life in the community with that? I don't know how anybody can justify that. The other thing we reminded him of was that while Senator Baucus particularly is somebody who is supporting the Republicans and trying to get bipartisan support, so we reminded him that in the previous administration, when Tommy Thompson was head of the Centers for Medicare and Medicaid, or actually head of the business, I think he was, and Mark McCollum was head of CMS, both of them were very strong supporters of community choice, and Tommy Thompson went on record as saying that he thought that community should be the default, and that you would have to prove why somebody would have to be pushed into a nursing home. Mark McClellan is the person who worked with ADAPT actually to get Money Follows the Person in the Deficit Reduction Act, and so there certainly is a history of Republicans who are very supportive of this. So I also mentioned when he was talking about the cost thing, we went through the whole issue about how the CBO cost, the scoring was, ridiculous, and how after the research was done, the CBO has retracted what they had said about the costing. And I told him that even here in Montana, before any of this happened, how our senior long-term care services, our senior long-term services department had years ago been moving people out of nursing homes, and they had saved, I remember the time that they had saved, I think it was like $1 million in the budget for moving people out of nursing homes, and they were going to use that money to increase the wages for people providing direct support in the community, providing that personal care. That was when the state was having a budget crisis thing, so they took that $1 million back. This is when Mike Hanshoe, I think, was still there, if I remember correctly. So he suggested that, he asked me when I'm in D.C. one of these times soon, that he would be happy to facilitate this if I would go over to the Congressional Budget Office and share that story. I told him I'd do that. But anyway, so the folks are still inside waiting to hear back, and then we'll kind of go from there. But I just wanted you to know sort of what was happening and
Hey, CCA, Max commit to it today. Hey, CCA, get it done. Max, you're the one. CCA, let's get her done. Max, you're the one. CCA, let's get her done. Max, you're the one. CCA, let's get her done. Max, you're the one. CCA, let's get her done.
And we were horrified at the thought of calling the police on us. That one gal really didn't want to call.
We're not going to
And then the police called here. This is the email from Lisa Stark, Senator Baucus' national scheduler. Bob, nice to speak with you. Per our conversation, I understand that you are looking for a meeting with Senator Baucus, Congressman Waxman, and Valerie Jarrett, misspelled. I will officially put your request into their process and keep you in the loop. Have a nice evening, Lisa. So we had originally gotten an email saying that she was working on a meeting with ADAPT Montana and the senator, and I called her back to clarify that we've already got the state scheduler working on that, and what we want is the national meeting with the key players in the healthcare reform. So, and I think that everybody in D.C., and you guys may know on Twitter, have been arrested.
they did the arrest?
Well, I just called Bruce and there was no answer.
Last I saw, Amber said that they were going to be arrested, but they hadn't been yet.
Yeah. Well, the last time I talked to Bruce, he indicated that he could be losing technology at any moment. So I think we did a good job, not only here but across the country. And I don't think the Democrats can not listen to the disability and aging community anymore on this issue. And hopefully we can get it to rise to the level of the single payer issue. It's time to, not that I'm against single payer, but I think we've got a better shot at getting something in than getting a single payer option, unless you consider the public option as a single payer, but it's only going to be a piece of it. So,
Woohoo!
Sweet.
Free our people.
Yeah.
Free our people. Free our people.
Free our people now.
Yes.